A boutonniere deformity is often called a buttonhole deformity. This is a rupture of the central slip insertion near or at its insertion onto the base of the middle phalanx. The head of the proximal phalanx then buttonholes through the defect in the central slip tendon. It results in a characteristic PIP joint flexion and DIP hyperextension. Mechanism of injury is a direct trauma to the dorsum of the PIP joint. It may also be an eccentric overload, so you may have a blow to the dorsum of the middle phalanx, forcing the PIP into flexion while the athlete is attempting to extend the finger. There may also be a volar PIP dislocation that reduces spontaneously. When you have this type of injury, the deformity is not immediate. It develops over 2 to 3 weeks as the lateral slip moves to the palmar direction. In this deformity, you will see a PIP hyperflexion and a DIP hyperextension. There will be edema near the central slip insertion. There will be pain and point tenderness over the central slip insertion on the middle phalanx. Attempts to extend the PIP are transferred distally via the lateral bands and all force is exerted on the DIP, resulting in a hyperextension of the DIP joint. The deformity is going to worsen over time if left untreated. What we will look for is a PIP joint extensor lag that is greater than or equal to 30 degrees, as well as weakness or inability of active extension of the PIP joint. An X-ray should be performed to rule out any type of fracture. Treatment will be based on whether it is an acute injury or a chronic injury. There is also a pseudo-boutonniere deformity, but this deformity is not the result of a central slip disruption.